Hello everyone, my name is Krisha May, and this is my presentation for prenatal growth and development from a psychological standpoint. In this presentation, I'm going to discuss a few main points. The first point is the 3 stages of fetal development, the factors, or a few of them, that can affect development, different ways that you can ensure a healthy pregnancy or healthy prenatal development, and lastly, how does this pertain to psychology? First, let's discuss the 3 stages. The first stage is also known as the first trimester. This is where a fertilized egg is implanted into the uterus. The placenta is usually formed around this time as well. And for those of you who don't know what the placenta is kind of a barrier. That protects the fetus from different bacteria and different harmful influences that could possibly cause any type of infection or put the baby at risk. This typically lasts from about the first 2 weeks after conception. The second stage, or the second trimester, is known as the embryonic stage. This is where all vital organs begin to form. This is also where most miscarriages take place. And typically this lasts from about 2 weeks after conception until the end of the second month of pregnancy. This is also a very important stage because this is where the neural tube begins to form. And that neural tube ends up developing into the brain and the spinal cord. The last trimester, or stage of pregnancy, is known as the fetal stage. This is where bones and muscles form. This is also when your vital organs begin to function. Nerve cells are forming here. And this usually is from the beginning of the 3rd month of pregnancy until the end of the pregnancy, or up until birth. Here is a picture that I found that shows it doesn't have, doesn't have the germinal stage. I apologize. It doesn't have the germinal stage on here, but it shows you the embryonic stage through the end of the pregnancy, and this just kind of gives you an idea of how the zygote turns into a fetus or a baby. Next, we're going to discuss the factors that affect development. Number 1 being poor nutrition. If the mother is not having the proper diet, or maybe she's not taking her vitamins or supplements that doctors have maybe prescribed to her, this can lead to problems with the developing fetus. Another one being smoking. Smoking during pregnancy can cause the child to be born with asthma. It is also linked to stillbirths and even SIDS, or sudden infant death syndrome, after the baby has been born. Another factor is drug and alcohol abuse. I don't know if any of you have heard of fetal alcohol syndrome. I'm sure you have. But this is what happens when a mother is a heavy drinker during her pregnancy. Side effects of this, or what usually happens, is a small head size. The baby can also be born with a cleft lip. Mental retardation is often a side effect of this syndrome. And it can also cause slow motor development. So huge things that affect the baby's brain are happening here. As far as drug abuse goes, the baby can be born with seizures, drug dependency, or it can even result in the death of the baby. Lastly, is a pretty broad, I guess just saying maternal illnesses doesn't really cover all of this, but this can be anywhere from the mother's depression and anxiety to maybe she has an STD or sexually transmitted disease such as herpes or HIV that can be passed along to the child, or that can cause developmental delays or issues. So those are all huge things that affect the baby's mental and physical ability to develop and grow at a normal rate. On this slide, I just put a couple of things together to just give an idea of what you can do to ensure a healthy pregnancy or a healthy prenatal development. Number one being prenatal vitamins. Anything that you're not getting in your diet or the mother is not getting in her diet, prenatal vitamins are excellent in putting those vitamins, those different things in there, those nutrients that really provide that baby with what it needs. Second, regular checkups and ultrasounds with your care provider are huge. That is what's going to pick up on any issues early on that the fetus or the mother may be going through, and early intervention is usually the best key to success. Lastly, I put avoid teratogens. Teratogens are anything that could harm the fetus or the pregnancy. So those are the things that I talked about on the previous slide, like poor nutrition, smoking, drugs, alcohol, all of those things. Lastly, how does prenatal growth, intertwine or pertain to psychology? And I have on here, improper prenatal care has been shown to lead to negative side effects with cognitive and behavioral development in the fetus that follows them throughout their lives. So a few of those, talking about that, a few of those other factors could be neuromotor delays. And a neuromotor delay is impairment in the nervous system that sends impulses through the body. So this can affect body movements as well as organ function. Shorter attention spans are also a result of this usually. ADD, ADHD, anxiety can be passed down from the mother to the child at birth. And then oh Lord. The last slide that I have for you, this is where I'll end, is with this picture that I found that shows the growth of a fetus's brain from 25 days of gestation up until 9 months or just before delivery of the baby. Everything from the food the mother ingests to the sounds that the baby can hear outside of the womb plays a significant role on a child's mental development. Thank you very much.